This is the first presentation in Neurovascular Imaging series prepared by Prof. Sharaf and revised by Professor Rami Edward. This picture shows the surface of the brain on the lateral aspect, where the anterior cerebral artery supply territory is represented by a band, the green band, and the middle cerebral artery supply territory is giving to the partly frontal, this is the central sulcus, and partly parietal, and this is the cerebral fissure, and partly temporal. So the middle cerebral artery has wide blood supply giving to the three lobes. Posterior cerebral arteries are giving to the occipital and region of cerebellum. Now this is the image from superior. This is a band representing the anterior cerebral artery supply, and this is the wide spread distribution of the middle cerebral artery, and this is the small area for the posterior cerebral artery supplying the occipital lobe and the region of the cerebellum. Again, along the medial aspect of the brain, as we remembered, it is the anterior cerebral artery supplying the region of the frontal, region of the parietal, and from the outer aspect region from the temporal. While the middle cerebral artery is supplying part of the parietal and part of the occipital, the posterior cerebral arteries are supplying the region of the temporal region as well as occipital region. Now this image is for the anterior from below, anterior cerebral artery territory, middle cerebral artery, mainly posterior cerebral artery giving the occipital and parietal from under surface. Here is the base of the skull. Immediately you can see the region of the medulla and region of the medullary pontine junction. It is supplied by penetrating artery from vertebral and anterior cerebral, while the cerebellum have its blood supply from the posterior inferior cerebellar arteries from the basilar. Now this is at a higher level, at the region of the pons and midbrain. Perforators are coming from the basilar artery, whereas the anterior choroidal is giving the region of the hippocampus, and anterior inferior cerebellar artery is giving the motion of the cerebellum here, while the superior cerebellar artery is giving the rest of the cerebellum. This is the basal ganglia caudate supplied by the medial lenticular striates branches of the anterior cerebral, and these are supplied by the thalamoperforators. Lateral lenticular striates are branches of the middle cerebral and are supplying the periventricular regions. Now this is the external carotid. External carotid branches, just to remind you: superior thyroid, ascending pharyngeal, lingual, facial, occipital, auricular, superficial temporal, and maxillary. The internal carotid has 6 or 7 segments according to some people. The cervical segment usually no branches. The petrous segment is called the carotico-tympanic artery, is giving the carotico-tympanic artery. The C3 is the part passing at the lacerum, foramen lacerum, C4 is the cavernous segment, and it is giving the meningohypophyseal trunk, and C5 is the clinoid segment where it gives cavernous and supraclinoid siphon. C6 is the ophthalmic. C7 represents the posterior communicating artery and the anterior choroidal artery. Here is a representation for the carotid, where it is passing through the bone, then within the siphon and the cavernous sinus, and then giving the branches anterior choroidal and communicating segment. So if we follow, we have the vertical part, then we have the genu, and then we have the horizontal part through the bone, and then we have the cavernous segment C4, and then we have where it gives the meningohypophyseal trunk here, and then it gives the ophthalmic. This is ophthalmic here, and this is the communicating going to the anterior cerebral part, anterior cerebral and middle cerebral. Anterior cerebral has mainly three segments: the region anterior origin at the anterior communicating, and this gives the medial lenticular striates, and A2 from the anterior communicating, recurrent artery of Hoopner and the frontal branches, and then A3, this is a bifurcation with to pericallosal and callosomarginal, and here it is. This is anterior cerebral, and we have the A2 vertical part, and then the distal A3. So we have A3 giving the two main branches, the callosomarginal and the pericallosal, and here you have the frontopolar artery, orbitofrontal and the frontopolar. Middle cerebral artery, we have 4 segments in some classification, and sometimes 6 segments, as C4, as M4 segment is divided into anterior, parietal and posterior. So the horizontal part is called M1, it's giving the lateral lenticular striates, the insular part giving the insular branches, the opercular part curving, and then the cortical branches beyond the sylvian fissure, and this is called the M4. Here it is. If this is the cortical, so it is M4, this one is M3, this one is M2, and this horizontal part is M1 with the medial lenticular striates coming from the M1, while the lateral lenticular striates are coming from the branches of the anterior cerebral artery. So if we have, this is the caudate, and this is the lentiform, and this is the insula, and this is the internal capsule. So we have M1, the branches to the subfrontal, to the frontal region. M2 branches and M3 branches are mainly parietal, while M4 branches, anterior M4, you can say posterior, middle M4 and posterior M4, or M4, M5, M6 are the cortical branches to the brain. Extraosseous vertebral, this is V1, foraminal, it's V2, extraspinal, it is V3, and intradural, it is V4. So we have 4 parts of the vertebral artery: cervical, intracranial, cervical, foraminal, extraspinal, and intracranial. The basilar artery is giving a lot of branches: anterior, inferior cerebellar, superior cerebellar, brainstem perforators, and posterior cerebral arteries, while the vertebral proper along the cervical region or the extradural segment is giving some muscular branches and spinal branches and posterior meningeal artery, while the intracranial segments are giving the anterior spinal artery and the posterior inferior cerebellar artery, BICA. Posterior cerebral artery, we have B1, B2, B3, B4. B1 is the mesencephalic from the posterior communicating, and it is giving the posterior perforators. B2 is the ambient segment passing through the ambient system. It's giving thalamogeniculus, thalamus. B3 is the quadrigeminal, or what we call posterior choroidal, giving posterior choroidal branches. And B4 is the calcarine, giving the calcarine. So if this is the calcarine branches, and this is the posterior occipital, parieto-occipital, so parieto-occipital, calcarine, superior cerebellar artery for this superior part of the cerebellum, then we can collectively say that the meningeal artery supply is from the three arteries, but mainly from the external carotid. The internal carotid can give meningohypophyseal trunk, and the ophthalmic branches can give some meninges. The inferolateral trunk can give some meninges. The external carotid is giving, frankly, the middle meningeal, accessory meningeal, sphenopalatine, branches of the ascending pharyngeal, branches of the occipital artery. All of these are coming from the external carotid artery branches. The vertebral artery is giving only the posterior meningeal. So the meningeal arterial supply is wide variety, but the main is the middle meningeal of the external carotid, coming from the external carotid. Thank you.